You are the nurse. Your diabetic patient needs insulin. The doctor has written Actrapid 8 units subcutaneous before meals. Do you know what type of insulin that is? Do you know when it will peak and when your patient is at risk for hypoglycemia? If you are not sure, this video is for you. By the end of this lesson, you will understand every major type of insulin, when each one works, and exactly what you need to watch for as a nurse. This is high yield for your exam, your test paper, and your very first day on a medical ward. Insulin is one of the most commonly administered medications in any hospital ward. As a nurse, you will draw insulin. You will administer it. You will monitor the patient after, and you will be the first person to notice if something goes wrong. The most dangerous complication is hypoglycemia, low blood sugar, which can happen when insulin peaks. To keep your patient safe, you must know three things. 1. When the insulin starts working, that is the onset. 2. When it works the most, that is the peak. 3. How long it lasts, that is the duration. Onset, peak, duration. These three words are your framework for everything in this lesson. There are 4 main types of insulin you need to know. Number 1, rapid-acting insulin. Number 2, short-acting insulin. This is also called regular insulin. Number 3, intermediate-acting insulin. The most common example is NPH. Number 4, long-acting insulin. Think of them as a spectrum, from the fastest to the slowest. We will go through each one now. After all 4, I will give you a comparison table and 2 exam questions. The first type is rapid-acting insulin. Common examples are Lispro, brand name Humalog, Aspart, also called NovoRapid, and Glulisine, brand name Apidra. Now, rapid-acting insulin works by binding to insulin receptors and allowing glucose to move from the blood into the body's cells very quickly. It was designed to mimic the natural burst of insulin your pancreas releases right after a meal. The onset, peak, and duration values for rapid-acting insulin are on your screen now. Study them. Because this insulin acts so fast, it is given just before a meal or immediately after, per provider order. The food and the insulin must match. If the patient skips a meal after receiving rapid-acting insulin, hypoglycemia can develop very quickly. Nursing priority. Always confirm the patient is about to eat before giving rapid-acting insulin. If the meal is delayed, hold the dose and contact the prescriber. This is a safety rule, not optional. Now, one important exam trap. Rapid-acting insulin is clear in appearance. Students confuse clear with regular. Remember, both rapid-acting and regular insulin are clear. Do not assume clear means regular. The second type is short-acting insulin, commonly known as regular insulin. You will often hear the brand name Actrapid. This is regular insulin. In your exam papers, it appears as soluble insulin or regular insulin. Now, because the onset of regular insulin is approximately 30 minutes, it is given 30 minutes before a meal. This is a classic exam question. Timing is everything with regular insulin. Remember, regular insulin means plan ahead. The onset, peak, and duration values are on your screen. Here is another key clinical point. Regular insulin is the only insulin type approved for intravenous use. For diabetic ketoacidosis, DKA, the insulin infusion running through the IV line is regular insulin. Monitor blood sugar closely during the peak window. That is when hypoglycemia is most likely. The third type is NPH insulin. NPH stands for neutral protamine hagedorn. Common brand names include Insulatard and Humulin N. NPH contains a protein called protamine that slows insulin absorption from the injection site. This makes it work more gradually, providing background blood sugar control over several hours. The onset, peak, and duration values are on your screen now. NPH has a peak. This means it carries hypoglycemia risk. Long-acting insulin, which we will cover next, does not have a significant peak. This difference is a major exam trap. Now, NPH is cloudy in appearance. This is because of the protamine suspension. Before injecting, it must be gently rolled between the palms, never shaken. Teach your patient, if your NPH is clear, do not use it. And here is a high yield mixing rule. When NPH is mixed with regular insulin in the same syringe, draw regular first, then NPH. The mnemonic is RN, regular first, then NPH, or simply clear before cloudy. The fourth type is long acting insulin. Common examples are glargine, brand name Lantus, and Detamir, brand name Levemir. Long acting insulin provides a slow, steady release over approximately 24 hours. It has no significant peak. It acts as a basal insulin background coverage that keeps blood sugar stable between meals and overnight. The onset and duration values are on your screen. Because long acting insulin has no peak, it carries the lowest risk of hypoglycemia among insulin types. But risk is not zero. Monitor still. Long acting insulin is clear, but it cannot be mixed with other insulins. It must be given in a separate injection. This is another classic exam trap. Long acting insulin is usually given once daily at the same time each day, per provider order. Remember, long acting is steady and slow, no dangerous peak, no mixing. Now let us bring all four types together. The comparison table is on your screen. Four types, four columns. Appearance, onset, peak, duration. Look at the curves together. Notice, rapid and regular are both clear. NPH is cloudy. Long acting is clear but peakless. The earlier and higher the peak, the faster you must watch for hypoglycemia. Rapid acting peaks the earliest. Long acting has no peak. Burn this table into your memory before your exam. Now, the safety section. This is not optional knowledge. This is what keeps patients alive. Hypoglycemia means blood glucose below the threshold shown on your screen. Check your college or organization reference for the exact value your curriculum uses. Signs and symptoms in 3 levels: mild, shakiness, sweating, palpitations, hunger, anxiety; moderate, confusion, irritability, difficulty concentrating; severe, seizures, loss of consciousness. Nursing actions, per your institution's protocol. If the patient is conscious and can swallow, give oral glucose or a sugary drink per protocol. If the patient is unconscious or cannot swallow, IV dextrose or glucagon per provider order and institutional protocol. You must know the peak time of whatever insulin your patient received. If your patient received NPH at 8 a.m. and it is now 12 noon, that is the peak window. Be alert. Teach every patient receiving insulin to recognize the early signs of hypoglycemia: shaking, sweating, feeling dizzy, and to carry a fast acting sugar source. Time for your exam practice. Question 1. A nurse is preparing to administer NPH insulin to a patient. Before drawing it into the syringe, what is the correct action? A. Shake the vial vigorously to mix. B. Inspect it. If it appears clear, it is safe to use. C. Gently roll the vial between the palms. D. Add it to the IV infusion line for slow administration. Pause and answer. The correct answer is C. Gently roll the vial between the palms. NPH is a suspension. It must be gently rolled to mix the protamine particles evenly. Option A is wrong. Shaking creates bubbles and damages the insulin. Option B is wrong. NPH should appear cloudy. If it is clear, there is a problem. Option D is wrong. NPH cannot be given IV. Only regular insulin can be administered intravenously. Question 2. A patient received regular insulin at 8 a.m. At what time should the nurse be most alert for signs of hypoglycemia? A. 8:30 a.m. B. 10 a.m. to 12 p.m. C. 2 p.m. to 4 p.m. D. The next morning. Pause and answer. The correct answer is B. 10 a.m. to 12 p.m. Regular insulin peaks at approximately 2 to 4 hours after injection. For an 8 a.m. dose, the peak window falls between 10 a.m. and 12 noon. This is when hypoglycemia is most likely. Monitor blood glucose per protocol. Ensure the patient has eaten. Let us recap. 4 insulin types: rapid acting, regular, NPH, and long acting. Each has an onset, a peak, and a duration. The peak is when hypoglycemia risk is highest. Rapid acting: give just before a meal. Regular: give 30 minutes before a meal. NPH, roll, never shake, cloudy appearance, has a peak, long acting, peakless, once daily, cannot be mixed. Only regular insulin can be given IV. Only NPH needs rolling. Never mix long acting with other insulins. Monitor your patients during peak windows. Know the signs of hypoglycemia. Know your institution's protocol. If this video helped you understand insulin, comment below. Which type did you find the most confusing before watching this? Save this video for your next revision. And subscribe to Nurse Metric, one nursing concept a day until you pass. Your exam is coming. You are more ready than you think. See you in the next one.